Hello, and welcome to our video on acidosis. Acidosis is a process causing increased acidity in the blood and other body tissues, for example, an increase in hydrogen ion concentration. If not further qualified, it usually refers to acidity of the blood plasma. The term acidemia describes the state of low blood pH, while acidosis is used to describe the processes leading to these states. Acidemia is said to occur when arterial pH falls below 7.35, while its counterpart, alkalemia, occurs at a pH over 7.45. Arterial blood gas analysis and other tests are required to separate the main causes. The rate of cellular metabolic activity affects, and at the same time, is affected by the pH of the body fluids. In mammals, the normal pH of arterial blood lies between 7.35 and 7.50, depending on the species. For example, healthy human arterial blood pH varies between 7.35 and 7.45. Blood pH values compatible with life in mammals are limited to a pH range between 6.8 and 7.8. Changes in the pH of arterial blood, and therefore the extracellular fluid, outside this range result in irreversible cell damage. The kidneys and lungs maintain the balance, proper pH level of chemicals called acids and bases in the body. Acidosis occurs when acid builds up or when bicarbonate, a base, is lost. Acidosis is classified as either respiratory or metabolic acidosis. Metabolic acidosis develops when the amount of acid in the body is increased through ingestion of a substance that is, or can be broken down to, an acid, such as wood alcohol, methanol, antifreeze, ethylene glycol, or large doses of aspirin, acetylsalicylic acid. Many other drugs and poisons can cause acidosis. Metabolic acidosis can also occur as a result of abnormal metabolism. The body produces excess acid in the advanced stages of shock, lactic acidosis, and in poorly controlled type 1 diabetes mellitus, diabetes ketoacidosis. Even the production of normal amounts of acid may lead to acidosis when the kidneys are not functioning normally, kidney failure, and are therefore not able to excrete sufficient amounts of acid in the urine. Metabolic acidosis also develops when the body loses too much base. For example, bicarbonate can be lost through the digestive tract due to diarrhea or an ileostomy. Metabolic acidosis develops when too much acid is produced in the body. And it can also occur when the kidneys cannot remove enough acid from the body. There are several types of metabolic acidosis. Diabetic acidosis, also called diabetic ketoacidosis and DKA, develops when substances called ketone bodies, which are acidic, build up during uncontrolled diabetes. Hyperchloremic acidosis is caused by the loss of too much sodium bicarbonate from the body, which can happen with severe diarrhea. Kidney disease, uremia, distal renal tubular acidosis, or proximal renal tubular acidosis. Lactic acidosis, poisoning by aspirin, ethylene glycol, found in antifreeze, or methanol, and severe dehydration. Some people may not experience any symptoms of metabolic acidosis. In those that do, the possible symptoms include the following: rapid and shallow breathing, confusion, fatigue, headache, sleepiness, lack of appetite, jaundice, increased heart rate, and breath that smells fruity, which is a sign of diabetic acidosis, ketoacidosis. Respiratory acidosis is a condition that occurs when the lungs cannot remove all of the carbon dioxide the body produces. This causes bodily fluids, especially the blood, to become too acidic. Normally, the lungs take in oxygen and exhale CO2. Oxygen passes from the lungs into the blood, and CO2 passes the other way for removal as waste. However, sometimes the lungs can't remove enough CO2. This may be due to a decrease in respiratory rate or air movement due to an underlying condition like pulmonary problems, head injuries, drugs, especially anesthetics and sedatives, brain tumors, pneumothorax, emphysema, chronic bronchitis, asthma, or severe pneumonia and aspiration. It can also occur as a compensatory response to chronic metabolic alkalosis. One key to distinguish between respiratory and metabolic acidosis is that in respiratory acidosis, the CO2 is increased while the bicarbonate is either normal, uncompensated, or increased compensated. Compensation occurs if respiratory acidosis is present and a chronic phase is entered with partial buffering of the acidosis through renal bicarbonate retention. However, in cases where chronic illnesses that compromise pulmonary function persist, such as late-stage emphysema and certain types of muscular dystrophy, compensatory mechanisms will be unable to reverse this acidotic condition. As metabolic bicarbonate production becomes exhausted, an extraneous bicarbonate infusion can no longer reverse the extreme buildup of carbon dioxide associated with uncompensated respiratory acidosis. Medical ventilation will usually be applied. There are two types of respiratory acidosis: acute and chronic. Acute respiratory acidosis. This occurs after a sudden spike in CO2 levels once your body becomes less effective at getting rid of CO2. This type comes on quickly and qualifies as a medical emergency. Without treatment, symptoms will get progressively worse and they may become life-threatening. Chronic respiratory acidosis. Certain chemoreceptors in your brain alert it to states of elevated CO2 and control your body's ventilation, or how it disposes of waste gases in your blood. When these receptors become less sensitive, they might not pick up on elevated levels, leading to chronic respiratory acidosis. This type develops over time and doesn't cause symptoms. Instead, your body adapts to the increased acidity. For example, the kidneys produce more bicarbonate to help maintain your acid balance. Chronic respiratory acidosis may also not cause any symptoms. Acute and chronic respiratory acidosis. Some people have chronic respiratory acidosis and develop a co-occurring illness that affects ventilation. This can make your chronic presentation worse, even if you've never noted any symptoms before. Doctors classify this as a combined type. Initial signs of acute respiratory acidosis include the following: breathlessness, headache, wheezing, anxiety, blurred vision, restlessness, and a blue tint in the hands and feet if oxygen levels are too low. Without treatment, or in people with severe presentations of respiratory acidosis, other symptoms may also occur, including sleepiness or fatigue, lethargy, delirium or confusion, involuntary muscle movements and twitching, possible seizures, personality changes, and coma. The chronic form of respiratory acidosis doesn't typically cause any noticeable symptoms. When signs do occur, they may include memory loss, coordination problems, increased circulation of red blood cells around the body, also known as polycythemia, high blood pressure in the arteries around the lungs, also known as pulmonary hypertension, heart failure, sleepiness, and headaches due to obstructive sleep apnea, OSA. People more at risk of developing respiratory acidosis include those undergoing surgery, with asthma, with end-stage COPD, who smoke, as it can cause respiratory problems, and who use opioids. Risk factors for metabolic and diet-induced acidosis include a diet high in salts and animal protein and low in fruits and vegetables, diabetes, kidney problems, and certain diseases such as Sjogren's syndrome. The healthcare provider will perform a physical examination and ask about the symptoms. Laboratory tests may be ordered, including arterial or venous blood gas analysis, basic metabolic panel with a group of blood tests that measure sodium and potassium levels, kidney function, and some other chemicals and functions, to show whether the type of acidosis is metabolic or respiratory, blood ketones, lactic acid test, urine ketones, and urine pH test. The diagnosis of acidosis generally requires the measurement of blood pH and carbon dioxide in a sample of arterial blood, usually taken from the radial artery in the wrist. Arterial blood is used because venous blood is generally not as reliable when measuring the body's pH status. To learn more about the cause of acidosis, doctors also measure the levels of bicarbonate in the blood. Additional blood tests are then done to help determine the specific cause. If metabolic acidosis is suspected, you'll need to give a urine sample. Doctors will check the pH of it to see if you're properly eliminating acids and bases. Additional tests may be needed to determine the cause of your acidosis. Other tests that may be needed to determine the cause of the acidosis include a chest X-ray, CT abdomen, urinalysis, and urine pH test. If you're diagnosed with respiratory acidosis, your doctor will want to check the health of your lungs. This may involve a chest X-ray or a pulmonary function test. Treatment of uncompensated metabolic acidosis is focused upon correcting the underlying problem. When metabolic acidosis is severe and can no longer be compensated for adequately by the lungs or kidneys, neutralizing the acidosis with infusions of bicarbonate may be required. Treatment of the cause, and sometimes fluids with bicarbonates, are given by vein. Almost always, treatment of acidosis is directed at reversing the cause. Doctors rarely simply give alkaline drugs such as bicarbonate to reverse acidosis. In metabolic acidosis, treatment depends primarily on the cause. For instance, treatment may be needed to control diabetes with insulin or to remove the toxic substance from the blood in case of poisoning. In respiratory acidosis, treatment aims at improving the function of the lungs. Drugs that open the airways, bronchodilators such as albuterol, may help people who have lung diseases such as asthma and chronic obstructive pulmonary disease. Sedation due to drugs and other substances can sometimes be reversed by antidotes. People who have severely impaired breathing or lung function, for whatever reason, may need mechanical ventilation to aid breathing. Severe acidosis may also be treated directly when it does not respond to efforts to treat the cause. In those cases, bicarbonate may be given intravenously. However, bicarbonate provides only temporary relief and may cause harm, for instance by overloading the body with sodium and water. Metabolic acidosis can lead to serious complications, including osteoporosis, which is a loss of the bone that can increase the risk of fractures, improper growth in children, as metabolic acidosis restricts the growth hormone, increased kidney damage, which can worsen chronic kidney disease, muscle loss or wasting, high blood sugar, problems with the endocrine system, the glands that create hormones, which can lead to insulin resistance and potentially diabetes, and increased risk of death. Complications of other types of acidosis also include osteoporosis. Osteoporosis can develop because if the kidneys and lungs are unable to get rid of excess acid, the body starts to take calcium from the bones. The body then uses this calcium to neutralize the acid. A 2012 study looked at the link between diet-induced acidosis and cancer. Research has identified a possible association between higher levels of acidity in the body and cancer. A long-term diet of acid-forming foods such as salt and animal protein can increase acidity in the body. Although there is not yet enough evidence to determine whether diet-induced acidosis alone could increase the risk of cancer, it may play a part alongside other risk factors such as obesity. Researchers need further evidence to support these findings. Acidosis prevention. You can't completely prevent acidosis, but you can do the following to reduce your risk of metabolic acidosis. Stay hydrated. Drink plenty of water and other fluids. If you're a person with diabetes, manage your blood sugar levels. If you use alcohol, consider cutting back. Chronic alcohol use can increase the buildup of lactic acid in the body. Thank you for watching, and have a great day.